vlogs. So today's video about the peripheral blood smear. So learning objectives. At the completion of this video, the learner will be able to state the appropriate sample used for the preparing a peripheral blood smear, describe the appearance of the well prepared blood smear, demonstrate the appropriate technique for the preparing a peripheral blood smear, evaluate peripheral blood smear for the acceptability in the clinical laboratory. There are three types of blood smears: the cover glass smear, the wedge smear, the sponge smear. The principle of the smear is the lot of the smears are prepared by placing a drop of a blood on a clean glass slide and spreading the drop using another glass slide at an angle. The slide is then stained and observed microscopically. For this, we required a EDTA specimen. So most of the smears are made from EDTA. So after collecting the blood sample, within the 2 to 3 hours, we have to make a peripheral blood smear. Before making the peripheral smear, we have to check microtinus for the clot with applicatory sticks. The requirements for the proper smear preparation: perfectly clean glass slides or cover slips, proper size blood drop, quick smooth spreading of a drop, rapid drying of a smear, proper placement of a drop. Prepare on the smear within 2 to 3 hours of sample collection. Procedure: mix the sample well, either by inversion or by mechanical rocker. Remove the stopper, holding the tube away from your face. Using 2 wooden applicator sticks, remove the tube and check for the fibrin clots. Then place a 1 into 3 inches slide on a flat surface. Place 2 to 3 mm drop of mixed whole blood about 1 by 4 inches from the right side of forested area of the slide. Utilizing the wooden applicator sticks or fill a capillary tube 3/4 full with anticoagulant specimen. Grasp a second slide in the right hand between the thumb and forefinger. Then place the spreader slide onto the lower slide in front of the blood drop and pull the slide back until it touches the drop. Allow the blood to spread by capillary action almost to the edges of the lower slide. Then push the spreader slide forward at the approximately a 30 to 45 angle using a rapid even motion. The weight of the spreader slide should be the only weight applied. Do not press down. Perform this step quickly. The drop of blood must be spread within the seconds or the cell distribution will be uneven. A thin film of blood in the shape of a bullet with a feather edge will be remain on the slide. Label the first edge with the patient name, hospital, unique hospital identity, number and date. Then allow the blood film to air dry completely before staining. This is the process of making a good peripheral smear. So this picture representing the whole procedure. So it's about the 2 slides, the 1 blood drop and the spreader touching to the blood and the method of spreading. So we learnt about how to make a good peripheral smear. So now we are going to learn characters of a good smear. The characters of good smears are: the first one is thick at one end, thinning out to a smooth rounded feather edge. Should occupy 2 to 3 of the total slide area. Should not touch any edges of the slide. Should be remain free except for point of the application. A well made, well distributed peripheral smear will have a counting area at the thin pour on the wedge smear, which is approximately 200 red cells with no touching. A good counting area is an essential ingredient in a peripheral smear for evaluating the number of and type of white cells present and evaluating red cells and platelet morphology. As soon as the drop of blood placed on the blood slide, the smear should be made without delay. Any delay results in the abnormal distribution of the white blood cells, with many of the large white cells accumulating at the thin edge of the smear. Rolex of the red blood cells and platelets clumping may be occurred. The thickness of the spreader when pulling the smear is determined by the three factors. The three factors are the angle of the spreader slide. The greater angle leads to the thicker and shorter angle leads to the thin smear. Size of the blade drop, second factor, and third factor is speed of the spreader. Example, if the hematocrit is increased, the angle of the spreader slide should be decreased. If the hematocrit is decreased, the angle of the spreader should be increased. So now we are going to learning about the common causes of root blood smear. So if we are using the too large or too small drop, it leads to bad smear. If you are using spreader slide pushed across the slides in a jerky manner, it also lead to poor blood smear. Failure to keep entire edge in the spreader side against the slide will making the smear. Failure to keep the spreader slide at the 30 to 45 angle with the slide. Failure to push the spreader slide completely across the slide. Irregular spread with a ridge and long tail. Edges of the spreader dirty or chipped dusty slides. The holes in film caused by contaminated with the fat or grease. The presence of the cellular degenerative changes due to the delay in the fixing, inadequate fixing time, or methanol contaminated with the water. So biological causes of the poor smear. Biological causes occur due to three reasons. One is the cold and agglutination, second one is the lipemia, and third one is the Rolex formation. In the cold agglutination, RBC will be clumped together. If it happens, we have to cool down, we have to warm up, cool down. If the temperature is high, we have to cool down at 37 degrees. If the temperature is low, we have to increase the temperature at 37 degrees for 5 minutes. Then we can make the smear. Lipemia. If the person have a lipemia, it also leads to the poor blood smear. So in this situation, we can't do anything to correct the error. The Rolex formation, it also the biological, due to the biological reasons, we cannot fix it the problem. This is about the peripheral blood smear, and in this video we learnt how to make a blood smear and the biological causes and general causes of making a bad smear. For upcoming video, we are going to teach you about the Roman vascular states. Until stay tuned. Thanks for the watching. Stay tuned. Subscribe, like and share Path Talks, formerly known as Pathology Talks.